Hello there, everyone. Good afternoon to everyone. For today's webinar, we'd like to extend a warm welcome to all of you. First and foremost, let me introduce myself. My name is Dayan Sendun Anak Belajar, and I am a graduate of Sultan Idris Education University. For today's event, I'll be presenting the webinar, and I'm delighted to welcome our panelists who will be giving a discussion during the session. For your information, the topic of today's webinar would be a healthy diet. But first, let me present our today's panelists. So our first panelist for today is Dr. Annalyn, who is a pediatrician. She has been working in this field for almost 5 years. So Dr. Annalyn, how are you today?
Hi, I'm doing good. Thank you.
Okay, thank you. Next, our second panelist for today is Dr. Ellen, who is a dietitian at Hospital X. How are you, Dr. Ellen?
I feel fantastic today. Thank you.
Okay. Next, our third panelist for today is Madam Amira. She is a mother of one child who works as a manager in a company. How are you, Madam Amira?
Yes, I'm good. Thank you.
All right. And our last panelist for today, our fourth panelist is Miss Shafika. She is a YouTuber influencer. How are you, Miss Shafika?
I'm feeling great today, thank you.
We will proceed to our next session. So everyone, the main topic here is healthy diet. But what does it mean to eat a healthy diet? A healthy diet is one that promotes or maintains good health. This topic learning outcome will include distinguishing proper nutrition intake according to life cycle, such as pregnancy and lactation, infant, childhood, adolescent, and adulthood, and discussing malnutrition and health concern associated with nutrition intake. So now, I'll welcome our first panelist for today, to start presenting. So, Dr. Annalyn, your time is yours.
Okay, thank you, Miss Moderator. Hi, everyone, and good day. First of all, I would like to say thank you for having me as a guest in this online webinar where we will talk about a healthy diet. Okay, let me introduce myself first. My name is Dr. Annalyn, and I am a pediatrician, and I have been working in this field for almost 5 years. Okay, let's go through to our topic today. Okay, what does it mean by a healthy diet? Why is healthy diet important for the children? Okay, we often hear this kind of question over and over again, right? Okay, let me explain it to you. Healthy diet means a variety food of that give you nutrient you need to maintain your health, to make you feel good, and to provide you energy. These nutrients include protein, carbohydrates, fat, waters, vitamins, and also minerals. Healthy diet is very crucial, especially at a very young age. Diet habits have the biggest impact on our health because if you are practicing a healthy diet, for sure your health will be excellent. Means that your blood pressure will be under control, your cholesterol level will be perfect, your immune system will be functioning at the very best, and you are free from getting any risk of diseases. Okay, means that if you eat healthy food, you will get a healthy body. Okay, as simple as that. Healthy diet should be practiced from very early stage of life so that the children they will used to practicing a healthy diet habit for the rest of their life, and they will live with a healthy body forever. On the other hand, unhealthy diet habit will lead to many health issues, including the most common one nowadays, which is obesity among children. I am very sure that each and every one of us here uh, often hear about obesity among children, or known as childhood obesity, right? Now, I will explain to you about the meaning behind obesity among children. Obesity among children, or childhood obesity, is a complex health issue. It occurs when a child is well above the normal or healthy weight for his or her age and height. Okay, overweight and obesity are defined as abnormal or excessive fat accumulation that presents risk to health. A body mass index, or BMI, over 25 is considered as overweight, and over 30 is considered as obese, according to the WHO. The causes of excess weight in young people are similar to those in adults, including behaviors and genetics. Okay. Obesity among children occurs as a result of an unhealthy diet, especially from food that contains high fat, salt, and sugar. As we all know, parents nowadays they constantly treat their children with food like processed food, fast food, and snacks that they can easily get from the restaurant, from the convenience store, and from the supermarket without they realizing that this habit could lead to childhood obesity for the children. Apart from that, this kind of unhealthy diet can lead to the other medical problems such as heart disease, stroke, type 2 diabetes, cancers, and deficit in brain function among children as they're growing up. Waste problem make children being unproductive, and they usually do not enjoy doing physical activities such as cycling, swimming, and jogging because they can easily get tired. Obesity also gives a strong impact on psychological health. This can be explained that children with obesity they tend to have a lower self-esteem as compared to the other children. They will be shy to socialize with other children and often isolate themselves from their peers because they felt like they are different from them. Uh, and they are not being confident to interact with their peers. Okay, we move on to the next topic on how to prevent obesity and other serious diseases among children. Okay, first, I want to advise parents to practice a healthy diet as well as healthy lifestyle when raising the children. For example, breastfeed is recommended starting from the newborn age to 1 year old to provide the best nutrient to the children rather than just giving them infant formula. I am saying this because a study proved that infant formula does not provide protective antibodies like what breastfeed gives to the babies. Infant formula also increases the risk of lead poisoning and can cause nursing bottle tooth decay among children. Okay. In the early childhood, parents should play a serious role in order to provide the best healthy diet for the children. This includes that children up to the age of 1 and 2 years old, they should not be allowed to consume food with salt and sugar in it. The children from the age of 6 months to 1 year old should be given natural based food such as plain rice, steamed vegetables, and fruit puree before introducing them to the other type of foods. Okay. Next, parents should not expose their children to food that contains high sugar and salt, preservatives, and fat, which often found in fast food, like I mentioned before, processed food, snacks, uh, and so on that can ruin their health. And lastly, to be assured that the children get the best nutrition, we as a parent should prepare homemade food that contains the right amount of carbohydrates, fibers, vitamins and minerals, proteins, and also fat and fatty acids. Okay, homemade food is the safest way to make sure that your children have a healthy diet habit because parents can they can control the right amount of food intake and food types that can be consumed by the children. Okay, I'm sure that each parent will give their children only the healthy food that can make the children healthy, right? Okay. I hope all these tips and sharing will guide our parents and also guardians out there to have a better vision of a healthy diet and to help to avoid health issues among children. Okay, that is all from me today. Thank you for your attention, and I will pass this session to our moderator. Okay, thank you.
Okay, thank you so much, Dr. Annalyn, for your explanation on health issues among children. So we have heard that Dr. Annalyn has explained how healthy diet can influence children's health, and then we have learned the types of health issues such as obesity, and we have learned that Dr. Annalyn has stated the effect on children's physical and psychological health, and she has also suggested on how to prevent health issues among children through healthy diet. So now moving forward to our second panelist, Madam Amira, you can start now if you are ready.
Yes, I am. Okay, Assalamualaikum and hi, nice to meet you all today. Me, Amira, I work as a manager in a company in Selangor. I am a mother of one child and this is my second child pregnancy. What I'd like to share today is about my experience through the morning sickness phase and the experience of facing nutrition problems during pregnancy. I believe that this morning sickness problems is faced by many mothers out there. So for me, the experience of dealing with my morning sickness was different from my first and second pregnancies. For my first child, it was a very horrible experience for me, where I faced a severe morning sickness, which is I will vomit 4 to 6 times a day, a severe headache that could cause fainting, then my weight dropped sharply and I became dehydrated. So the doctor told me if this thing continue and got worse, I chance where I will give birth to a premature baby. The doctor gave me some vitamin and nutritional supplements and suggested me to eat nutritious food, eat a bland diet, eat frequent small meals, drink plenty of liquid when not feeling nauseated, avoid spicy and fatty foods, eat high protein snacks, and avoid sensory stimuli that can act as triggers like specific smell or noises. No doubt that I was very scared and worried about my son condition at the time. So with the support given by my husband and family, I am determined to follow what the doctors recommended to me and change my lifestyle for the better. And yes, my morning sickness that I experienced is less and better, and I can give birth to my first child safely and healthily. So for my experience in terms of nutrition problems during pregnancy as well, I often experience a gastrointestinal distress, which is I experience bloating, vomiting, and stem from infections and even food allergies. In addition, I also experience food craving like other mothers who sometimes crave street foods and so on. And this also requires balance control for healthy food intake. However, there was a time when I also experienced non-food craving where I wanted to eat soup. Doctors explained that this is a condition called pica, and it may indicate a mineral deficiency or severe anemia. And lastly, I had diabetes only when I was pregnant. This is called gestational diabetes. Pregnancy can change how a woman's body uses glucose. Doctors recommend focusing on keeping blood glucose level in the normal range and might include a careful diet with low amounts of carbohydrate foods and drinks for sure, exercise, and blood glucose monitoring. Lastly, I just want to share that expectant mothers are always instructed to always maintain a healthy diet, especially during pregnancy, because of worries with the occurrence of malnourished fetus. Malnutrition happens when the body does not get sufficient nutrition that are essential for it to function normally. Nutrients are classified as micronutrient, which is protein, carbohydrate, and fats, while micronutrient, which is vitamin and minerals and water. It is a risk to the health of the mother and the fetus, which can cause miscarriage and a risk for the fetus to get serious health problems. So, as an experienced mother, with advice and enlightenment from many doctors, it is important for everyone to take care of their diet so that they eat a healthy and balanced diet in terms of proteins, vitamin, carbohydrates, and so on, especially for pregnant women. A healthy and balanced diet is very important for the health of mother and child. That's all the sharing from me. Thank you.
Okay, thank you so much, Madam Amira, for your sharing as a pregnancy woman, where you have talked on about morning sickness and then the nutrition problem during pregnancy, and also you have shared about malnutrition fetus. So thank you so much, Madam Amira. Now we move forward to our third panelist, Dr. Eileen. If you are ready, the time is yours.
Hello everyone, thank you. I'm Dr. Erlin, currently working as a dietitian at Hospital X. I just want to share a bit about the component of nutrition in food, the importance of nutrient, the impact of malnutrition, and excessive intake of nutrition. Firstly, as we know, the nutrition in food that we need in our diet is carbohydrate, protein, fat, vitamin, and minerals. We need carbohydrate to provide energy for our body to do our daily activities. For pregnant women like Madam Amira Tulhana, they have to take about 175 gram of carbohydrate per day because they need 15 to 20% more energy than before their pregnancy. For children, carbohydrate intake depends on their age, size, and activity level. Toddlers are recommended to take about 1,000 to 1,400 calories. The same for adults and need to increase their fiber intake. We know fiber is like vegetable and fruits. Next, we need protein as it helps us maintain strong bone, promote muscle growth, and keep us feeling full. Protein intake for men and women is around 0.8 gram per kilogram of their body weight, while for pregnant and breastfeeding women, they have to take around 1 gram per kilogram of their body weight. Then let's talk about fat. What are fat? Fat are nutrients in food that the body uses to build nerve tissue, including the brain nerve and hormones. Along with protein and carbohydrate, fat also provide energy to our body. Fat are needed in our body as a fuel, carriers of vitamins, protect internal organ, heat insulator, provide effect of stomach fullness, and help information of tissue and organs. The last component in nutrition is vitamin and minerals. Vitamin are any various of organic compound, while minerals are inorganic nutrients. Vitamin and minerals are needed in our diet intake in a small amount. The example of minerals that the body needs in is cal- calcium, which help build strong bone, health teeth that can be found in dairy products such as milk, cheese, and yogurt. There are also 5 types of vitamin, which is vitamin A, B, C, D, E, and K that our body needs. All food are good for our health if taken in correct amount based on our body needs. The excessive intake of carbohydrates may lead to weight gain and obesity. But when we do not take carbohydrate in sufficient quantity, we will have no energy to do our daily activities. It is very dangerous, especially for pregnant women, because it can lead to improper placenta development. Not consuming enough protein can cause muscle cramping, weakness, soreness, edema, and greater risk of bone fracture. While excessive intake of protein can lead to weight gain, constipation, diarrhea, dehydration, and heart disease. Next is the effect of fat deficiency. The fat, the fat deficiency is vitamin deficiency, since fat help absorb vitamin in our body. Skin problem caused by fat deficiency is dry skin because lipid coat the outer layer of skin, keeping the body from losing water. But too much intake of fat will put us at risk for getting chronic disease. Vitamin and mineral deficiency may lead to weak immune system, prone to infection, tiredness, skin disorder, dry and cracked lips. Last but not least, excessive intake will give us dizziness, high sugar level, nerve damage, and can cause serious damage to the heart and liver. That's all from me. Thank you.
Okay, thank you so much, Dr. Elin, for your explanation as a dietitian, where you have talked about the component of nutrition in food, and you have also explained the importance of nutrient and the impact of malnutrition. Okay, now moving forward to our last panelist, Miss Shafika, if you are ready, you can start now.
Thank you for our moderator. Assalamualaikum. Hi everyone. My name is Shafika Hakia and I'm a YouTube influencer. Thank you for having me today. So today I will share with you how to make an eating plan for each week. I believe the simplest way to approach meal planning is with these three steps. The first step is selecting recipes. The second step is shopping for ingredients. And the third step is preparing your meals. These steps might seem pretty obvious, but they are critical strategy to make healthy food preparations. With these steps, you can avoid to eat unhealthy food. As a YouTube influencer, I have shared a healthy and simple recipe. A healthy breakfast, lunch or dinner doesn't always to be a traditional menu. For breakfast example, you can cook oatmeal topped with almonds or dried cranberries. You also can cook whole wheat pita stuff with hard-boiled egg and vegetables such as spinach. These simple ingredients is easy to have, easy to cook, and contains a lot of nutrients. So there are many choices you can make a healthy diet at your own home. Then, if you want to achieve a healthy diet, you must eat a combination of different healthy food. For example, fruit, vegetables, nuts, legumes, and a whole grain. You also must eat less salt and sugar. Consuming excessive amount of sugar will increase the risk of tooth decay and unhealthy diet. By taking more salt and sugar, you will facing health problems. I think that's all from me today. I hope you will eat healthy food to have a healthy lifestyle. Thank you.
Again, right now we are going to proceed to the next session, the Q&A session, and I have prepared some question to all of our panelists for today's webinar. So, the first question I would like to ask is to Dr. Elin. Dr. Elin, are you ready for the question?
Yeah, I'm ready.
Okay, so the question is, what role do nutrients play in a healthy diet?
Oh, okay. Thank you for the question. As I just explained, the nutrient in food that we need in our healthy diet are carbohydrates, protein, fat, minerals, and vitamin. We need carbohydrates and fat to provide energy for our body to perform daily activities, protein to build strong body structure, and vitamin and minerals for the normal growth of our body. All food are good for health if taken in correct amount based on our body's need, but excessive or deficiency of nutrients can cause chronic disease. That's all from me. I hope it's answer your question. Thank you.
Okay, thank you so much, Dr. Eileen, for your answer on the role of the nutrient plate in healthy diet. Okay, next I would like to ask Dr. Annalyn. Dr. Annalyn, are you ready?
Yes, I'm ready.
Okay, so the question is, how can we maintain a healthy diet in our daily life?
Okay, thank you, Ms. Moderator, for the question. The first way we can maintain a healthy diet is by avoiding unhealthy food intake, especially from food that contains high fat, salt, and sugar, such as processed food, like I mentioned before, processed food, snacks, and fast foods. Okay, apart from that, parents should be responsible to practice a healthy diet and a healthy lifestyle when raising their children. For example, toddlers under the age of 1 and 2 years old should not be given food that contains high sugar and salt. Okay, practicing this kind of healthy diet can avoid the children, from getting any type of health diseases such as type 2 diabetes, heart attack, stroke, cancers, and deficit in brain function. Okay, I hope this explanation will be enough to answer your question. Okay, thank you.
Okay, thank you, Dr. Annalyn, for giving your answer on maintaining a healthy diet in our daily life. Now, moving on to the next question is for Madam Amira. Madam Amira, are you ready?
Yes, I'm ready.
Okay, so the question is it really necessary to take medicine while pregnant in order to eat a healthy diet?
For me, pregnant mothers need to take the medicine. Is it because pregnant mothers need to have enough nutrients in the body, not only for the health of the mother but also the baby? Vitamin supplementation is recommended to supplement the necessary nutrient needs for the mother, but also for the growth of the baby in the womb. The intake of vitamin and health supplement during pregnancy is encouraged because it can reduce the risk of birth defect, premature birth, and underweight. Medication or supplements that are mostly recommended by doctors to pregnant women are such as folic acid, calcium, iron, and vitamin D. Whatever, before taking any medication, I should talk to a doctor first. Yeah, thank you.
Okay, thank you, Madam Amira, for your explanation. And it looks like our fourth panelist is still having line problem. So thank you so much again to our first, second, and third panelists for today's webinar. So before I conclude today's webinar, I would like to say that a healthy diet provides the nutrient that your body requires to function properly. A well-balanced diet boosts your metabolism with the nutrition it requires to function properly. Without balanced nutrition, your body is more prone to disease, infection, fatigue, and low performance. As a result, maintaining a nutritious diet is very important. So this concludes the webinar. Thank you all for attending. We hope you learned something today and enjoy yourself. But before you left, please feel free to fill up the attendance link that we have given. Thank you.